Hypertension, also known as high blood pressure, is called the silent killer. But why? Because most people living with it don't even know they have it until it's too late. Hypertension happens when the force of your blood against the walls of your arteries is too high for too long. Over time, this puts serious stress on your heart and blood vessels, increasing your risk for heart attacks, strokes, kidney disease, and more. According to the World Health Organization, over 1.2 billion people worldwide live with high blood pressure, and nearly half of them don't even know it. So, it affects people of all ages, but especially adults over 40. And honestly, it's becoming more common in younger people these days, mostly because of stress, diet, and, lack of exercise. Hypertension can be caused by a lot of different factors. Some are within our control, and, well, some are not. Genetics or family history, obesity or being overweight, high salt intake, excessive alcohol or tobacco use, stress and anxiety, lack of physical activity and kidney disease or hormonal disorders, all of these can put you at a higher risk. Most people with hypertension have no symptoms. It's often called the silent killer for a reason. And honestly, that's what makes it so dangerous. People can go years without knowing they have it. But when symptoms do show up, they might include things like headaches, which can be quite severe, blurred vision, dizziness, chest pain, shortness of breath, irregular heartbeat, and these can be warning signs of something more serious. Or even just feeling really fatigued. It's crucial to get regular checkups to catch it early. If you're experiencing these symptoms on a regular basis, it's important. Get your blood pressure checked immediately. Hypertension or high blood pressure is diagnosed using a simple but essential tool, the blood pressure monitor. This device is commonly found in clinics, hospitals, and even at home, making it easy for anyone to check their numbers regularly. Monitoring your blood pressure is the first step in understanding your heart health and catching any problems early. A normal blood pressure reading is usually around 120 over 80 millimeters of mercury, often written as 120/80ths mmHg. This is considered the ideal range for most adults, and it means your heart and blood vessels are working well together. Regularly checking your blood pressure helps you stay within this healthy range. If your numbers fall between 130 over 80 and 139 over 89, that's considered elevated or stage 1 hypertension. At this stage, you may not feel any symptoms, but your risk for heart disease and stroke begins to increase. It's important to take these readings seriously and talk to your healthcare provider about lifestyle changes or treatment. Readings of 140 over 90 and above mean you have stage 2 hypertension. This level of high blood pressure puts extra strain on your heart and arteries, increasing the risk of serious health problems. Your doctor may recommend medication, along with changes to your diet and exercise routine to help bring your numbers down. And if you see a reading of 180 over 120 or higher, that's a hypertensive crisis, a medical emergency that requires immediate attention. In this situation, you should seek emergency care right away, as dangerously high blood pressure can lead to stroke, heart attack, or other life-threatening complications. Always know your numbers and act quickly if they're too high. You can get tested at a clinic, a pharmacy, or even right at home using a reliable device. Treating high blood pressure might involve a combination of medication and, well, some lifestyle changes. Medications may include things like ACE inhibitors, beta blockers, diuretics, and calcium channel blockers. When it comes to making lifestyle changes, you have more power than you might think. Small, intentional choices can lead to big improvements in your health and well-being over time. Let's talk about some practical power moves you can start today. First, try to reduce salt and processed foods in your diet. This means checking nutrition labels, cooking more meals at home, and choosing fresh ingredients whenever possible. Even swapping out salty snacks for fruits or nuts can make a real difference in your blood pressure and heart health. Next, aim to get at least 30 minutes of exercise each day. This doesn't have to mean hitting the gym. Walking, cycling, dancing, or even gardening all count. The key is to find activities you enjoy, so you'll stick with them and make movement a regular part of your routine. It's also important to limit alcohol, and if you smoke, do your best to stop. Cutting back on these habits can lower your risk for many serious health problems, and there are lots of resources and support groups out there to help you succeed. Maintaining a healthy weight is another key step. This isn't about strict dieting, but about making balanced food choices and staying active. Even small changes like cooking with friends or tracking your progress can help you stay motivated. And don't forget about stress. Learning how to manage it can make a big difference. Try meditation, yoga, or simply taking a few deep breaths during a busy day. Finding healthy ways to relax helps your mind and your body. These steps might seem simple, but when you put them together, they truly add up. Over time, these small changes can transform your health and help you feel your best every day. Hypertension is often preventable. Start with these small but powerful steps. Monitor your blood pressure regularly. Eat a diet rich in fruits, vegetables, and low-fat foods. Cut down on sodium. Stay active, sleep well, and manage stress. And avoid smoking and excessive alcohol. Prevention starts with awareness and action. Hypertension is serious but manageable. Don't wait for symptoms, know your numbers, take charge of your health today. If this video helped you, please like, share, and subscribe for more life-saving health content. Have questions or your own story about